once we're done. And so I just want to welcome everybody to our this week's edition of our Chamber Chat. And so we have Chuck Prosper, who is the Chief Executive or the Northwest Chief Executive of Peacehealth. Correct? Did I get that correct?
That is correct. I'm the Chief Executive for the Northwest Network, and my primary home and my primary work location is St. Joseph Hospital in Bellingham.
Awesome. Well, thank you for being here. Just so I can throw some love to some of our sponsors with the Chamber, you can see to my right, one of the side that's got the logos on it. We have BP Cherry Point and US Bank. Both of these amazing Chamber members and Chamber partners stepped up to support our Chamber Speaker Series, which is an in-person event at the beginning of the year, end of last year. And so we want to just acknowledge their support to this community, to our organization, and give them some love in the meantime until we can meet back in person for our Chamber Speaker Series or pivot those to digital format later this year. So Chuck, let's get into the conversation because I know we're on a timeline. And if anybody has any questions, just put those in the Q&A, and if we have time, we will get to them. But I want to honor everyone's time commitment, specifically Chuck, because I know you have a 4 o'clock. And so just want to timestamp this for those that are watching the recording. This is being recorded at 3:30 on May 20th. I think it's Wednesday. That's what I'm going with. So Chuck, tell us a little bit about you're fairly new to the role and to the community, as I understand.
That's correct. So I've been a resident of Bellingham for a little over a year now. I'm a physical therapist by training. That's how I got started in the whole healthcare world. I've been working in healthcare for a little over 31 years now. And I'm recently transferred from the San Francisco Bay Area. So I live in San Francisco up until a year ago. I have a son who's just finishing his senior year. And so he'll be moving up to Bellingham soon. But I really started off as a physical therapist. That's how I really became the first caregiver experience. And then throughout the years, I developed an interest in leading and helping to really have a greater impact rather than just a single patient at a time across a whole organization. And being part of Peacehealth and serving its mission here in the Northwest Network is just a truly, truly enjoyable honor. So that's a little bit about me.
Awesome. Well, I'm sure he'll love it when he gets up here. So
yeah.
So before we get into the conversation about the pandemic, because that was the impetus for creating these Chamber Chats, I want to talk to you a little bit about the hospital. What do you feel is the best part of our hospital? What were you most surprised to learn when you got here? And perhaps another way of looking at it is, what is the one aspect that you would want to tell people? So maybe when you're talking to your peers and colleagues down south, what are those things that you tell everyone about St. Joe's?
So St. Joseph Medical Center really is a far more capable institution than you would normally expect in a size of community that we have today. I think that we have physicians in our community that really enjoy having Bellingham be their home. There's a wonderful lifestyle, wonderful set of lifelong experiences to raise children, to have recreation. And so I'd say that the caliber of physician here is far higher than one might expect. And as a result of that, some of our services like cardiovascular services, oncology, some other surgical specialties like orthopedics, as well as our capabilities in the emergency department are all incredible strengths of Peacehealth and St. Joseph. I think the other part, though, that I'm really impressed with is how well this community works together. So we have, of course, the Peacehealth Medical Group, which is our medical group that focuses on primary care and specialty care. But we also have other amazing providers like FCN, federally qualified health centers like CMAR, Unity Care Northwest, and just a real strong connection to our city and county. So I think that probably the one thing that am really proud to talk about is how integrated the hospital is in the total healthcare delivery system. So we have at the beginning people who have primary care, people who go to their doctors on a regular basis. Let's say they have an acute care need that brings them into the emergency department or into the hospital. But then we are able to return people to the community with a really strong, not only that community of providers, but also skilled nursing facilities and long-term care facilities. So this is just an amazingly integrated community. So Bellingham and Whatcom County is really quite fortunate in what they have built.
Nice. And I think of the comment or the regard for the sense of place. A lot of our employers, that's a selling tool, and as someone that's been in the chamber industry for almost a decade and a half now, in our community, that's definitely one of our big selling points. So it's always interesting to know how that impacts our small employers as well as our largest employer in the hospital. So the post-pandemic, which I think is sometimes difficult for a lot of us to wrap our head around, that we need to plan beyond the next months or year and a half, 2 years, whatever that time frame looks. What is the future for the hospital post-pandemic?
So we are in what I describe as our recovery mode right now. So let's go back into a time machine 10 weeks ago when COVID was really just emerging as a highly risky, highly dangerous, not very well understood disease. We had watched it in China, we had watched it ravage through Italy, and then now we had incidents of COVID in South Washington or in the Seattle area. So what we did is we immediately said, what do we need to do? We need to preserve personal protective equipment, essentially those gowns and gloves and goggles and masks that help protect us from this type of infectious agent. We also have to think about what it means of capacity at the hospital. When we looked at the incidents in China and in Italy, you saw images of people overwhelmed in intensive care units and folks just overwhelming the hospital resources. So we began to prepare even before the governor declared that we should hold off on elective surgeries and other procedures that can be delayed without any harm to the patient. So what that did is it really just shut down a large portion of the lifeblood of our organization, but we wanted to be ready. So we were preparing for the worst and hoping for the best. We had converted parts of our hospital to additional inpatient capacity. We had purchased additional ventilators so that we would be able to create essentially from the normal 24 ICU beds today, the intensive care unit beds, up to a capacity of 60 and greater. So we were working not only to double our intensive care unit and ventilator capacity, but actually working on a way to triple it. Luckily, that surge never came. Many of the things that were related to the stay home, stay healthy strategies paid off. And so we really did flatten the curve, and the Whatcom County and Bellingham just didn't see the big impact to the disease that other communities did. So we are in a recovery mode now. So part of that is then going back to our normal operations, resuming surgeries, resuming other procedures that really shouldn't be deferred any longer, and helping to get the message out there to all of the residents that continuing your relationship with your doctor, continuing your own health maintenance is something that you should absolutely do. The last thing we want to have happen is have folks be worried about coming in and accessing healthcare, worried about going to a doctor's office, and end up having their medical condition worsen. So really, that's a key part of our message right now. We are taking the necessary steps to mask everyone at the front door, screen everyone at the front door. No one in the hospital is within 6 feet of each other without a whole lot of protective gear. So we are doing all of those steps to make it a very safe environment, and that's going to help us with our recovery.
Nice. So this was a kind of an interesting question, and some people, not a lot, but I've heard it a few times over the last couple of years, mentioning the need for a second hospital. So as a
Hmm.
hospital administrator, what are your thoughts on this? Is there a need? Is competition, which is sometimes, and I would say usually in a business setting, competition is good for the end consumer. But just kind of what are your thoughts? Because I think a hospital is a little bit of a different scenario for a community.
Well, and the infrastructure of a hospital is an incredible investment and a highly regulated and highly complex organization to maintain. So, first of all, what I'd like to say is when people start to think about, well, what are my choices beyond a hospital? I think you have to step back and say, okay, where is the future of medicine going? This pandemic and over these past several weeks actually accelerated movement to more virtual visits, more telehealth visits, and really people began to explore other options to receive healthcare. So even before the pandemic, when I came into this community, I said, wow, this is an awesome responsibility to be the hospital that cares for this community. But what I realized is that much of the care, the majority of care that someone receives is actually through a relationship with their primary care physician, perhaps an OBGYN specialist as someone begins planning for a family, as well as the occasional surgical intervention. So the hospital is often sort of the last step, the last most highly acute setting. So when I actually look at competition and choice, because I think that's fundamentally what people would like, there's lots of choices in this community for healthcare access. So I can be selfish a little bit and say, well, you know what, we want to continue to serve this mission for this community. Um, but it's also recognizing that we can't do it alone. We actually have to rely on this full network that I described earlier of these other healthcare providers with primary care, as well as these skilled nursing facilities and extended care facilities or home health agencies where additional care is provided. I think the last thing I'll say, especially since I'm speaking to a business group who really understands the complexity of business, is that when you have a highly regulated industry, when you have operating rooms and very expensive MRIs and CT scanners, those are significant investments. And so, what we're seeing in other communities when hospitals are a little bit smaller or they don't really have the capability to invest in themselves, they're really at risk. And so for us, part of our mission actually helps us to stay stronger. Every single dollar that we raise goes back into the organization through investment in new facilities and new equipment, as well as paying really good wages to our nurses and other skilled professionals who can actually stay and work in this organization. So I'm a little biased, but that's my answer.
Great. So kind of pivoting to dialogue, or pivoting back a little bit to the dialogue regarding the pandemic. I think you've mentioned and talked about how did you prepare for it when you saw it kind of coming on. How well do you think you and your team did, and are there things you would do different now that we're kind of 3 months into it?
Hmm. So I'll tell you a few things that went really, really well. We were able to watch, we were able to learn, and we were able to prepare based on the experiences of others that went before us. Secondly, our entire community of physician providers came together. So not only the hospital, not only the physicians that are used to practicing in the hospital on a regular basis, but other physicians in the community. We pulled together essentially a virtual think group that we would have conversations every morning throughout the entire pandemic, talking about how we manage our patients, how we manage our surgical needs, how we manage the shortages or the inconsistent supplies of personal protective equipment. There was a real coalition of thinking that came together. And so it's really the partnership that I saw among all the providers in our community wanting to care for the total health of our community. So it was a very unifying effort. So I think that was an area where things went very, very well. The conversion of our hospital to create those additional intensive care unit beds and other areas also went very, very well. We I never lost sleep at nighttime about having an adequate number of ventilators. We always had enough. We were able to have triple capacity for our intensive care units. Thank goodness we didn't need those many ventilators. But you know, part of our preparation made sure that we always had enough resources. It was scary at times though, because when you would place an order and things wouldn't arrive, you'd be like, okay, what do we do today? What do we do differently? How do we innovate? And so luckily, the Centers for Disease Control really put out guidance, and they said, hey, if you're not getting consistent personal protective equipment, this is how you change your practice to still be safe, but to extend the use of those supplies. And that's exactly what we did. But I think if we had something that we could have done better is always to communicate more. You can never get your message out enough. You can never communicate enough to people to help reassure them, to help them feel more comfortable about what's going on. This was a situation where the information, the science, the official recommendations changed every 24 to 48 hours. And that is something I've never experienced in my 30 plus years as a healthcare provider. Normally, if you have a disaster, it's, the tornado came or the earthquake happened. And then everything you managed after that event. But here, the event kept evolving, and it's been the longest sustained emergency response we've ever done. So our providers and our caregivers are trying to squeeze in a little bit of rest and recovery right now.
Oh, I bet, and I think a lot of people are doing that same thing. So one of the things that you mentioned, just kind of a follow-up question regarding instructions or guidance from the CDC. Is that your go-to? Because I know there's also the Department of Health at the state level, but when you're looking for that health guidance, who does the hospital say we're following their directive?
So one thing about being a hospital, and you're often under multiple jurisdictions. So obviously the state licenses you as an organization. So you absolutely have to follow state guidelines. The Center for Medicare and Medicaid Services basically also provides guidance on how to care for patients with Medicare or Medicaid. So they also have a set of regulations. And then, of course, CDC was providing the scientific guidance, essentially the best practice. So hopefully all of those line up. Sometimes someone would come out with guidance and then the other agency would catch up within 24 hours. But for the most part, we would look at all three and make sure that the path that we were taking satisfied those three major entities.
Okay. So touching on elective surgeries. So the governor just opened that as part of this current phase. And so what does this mean for St. Joe's? How important is that reopening of that sector of your industry?
So it's incredibly important, not only for the hospital, but for many of our physician providers in the community. So when you think about what it means for some of our other local surgery centers to stop elective surgeries under the governor's order, that had a big impact on many physicians. Originally, the governor's order, he permitted certain cases that, if delayed, would have otherwise provided harm to the patient, that we could still proceed with those. So if it was a no harm situation, we would wait. If there was any chance of increased disability, pain, or any other negative outcome, those cases would still proceed. So throughout this entire time, we had a small volume of surgical cases always going through the hospital. Obviously, we're a trauma facility, so if someone came in through the emergency department or through our trauma activation service, they would have surgery. But right now, I think of it more as we're gently turning up the dial, just like the entire state is trying to turn up the dial. How do you reopen safely? So this portion of turning up the dial is vital for the hospital and vital for physicians in our community. We're watching very carefully to ensure that we always have an adequate supply of beds, staffing and personal protective equipment should there be an unexpected spike in our community as our state navigates reopening.
Mhm.
But it's very important. And I think most importantly, it allows our doctors and our nurses and other caregivers to go back to a sense of normal practice, which I
Mhm.
think is very important. They put forth so much personal, emotional commitment and energy that we not only do we need to recognize them, but we also need to get back to a normal path again.
Mhm. I think there's many industries that are very interested in getting back to that normalcy. So my final question, and I'm still managing the clock, so we've got a couple minutes. And you
Great.
actually just touched on this a little bit, but what's the plan for the future of this COVID pandemic? And are we prepared if we see a second or third wave before we have some sort of a treatment option or possibly vaccine long term?
So this, I used the analogy earlier today that what happens in the summertime, the squirrels all go out and collect their food and they do their winter stores. And that's exactly what we're doing. We're using this pause or this gap in the COVID pandemic to basically double down. So to continue to build our inventory of personal protective equipment, to identify that some of the structures that we put up that were temporary in nature because we put them up quickly, to perhaps memorialize those in a little bit more semi-permanent or permanent structures, because we are anticipating that that this will come back again. Not We don't know if it'll be to the same degree, but we want to be even more prepared this fall than we were this past winter. We were in a good state of preparation, but we're really working hard to double our efforts throughout the summer.
Awesome. Well, I'm not seeing any Q&A, so I must have did a really good job of coming up with a robust, comprehensive list of questions. So I just want to say thank you. Thank you for your time. We're getting you out about 5 minutes before your next meeting, which I know we all can appreciate. We also want to thank again our sponsors for this series, BP Cherry Point, US Bank. Chuck, it was very nice to chat with you. Thank you so much for your time, for your leadership, and I've got to throw a special shout out to your team. They are amazing to work with, and very supportive and have been for years. So thank you.
Well, thank you very much, Guy. And the one thing that I would normally do if this was an in-person discussion, but it applies exactly in this Zoom discussion or webinar, is that for any member of the chamber or anyone who's listening today and says, well, what does it mean for my organization? What does it mean for my company? Hey, I'd like to learn more about what the hospital's efforts look like. I am more than happy to have a conversation, go a little bit deeper with any chamber member, or to also to in person show a little bit of the things that we've done and how we prepared. I'm more than happy to continue the dialogue in any way that feels good. So thank you very much for the time today. Appreciate it.
Absolutely. And if anybody in the attendee list is interested in making that connection, just as usual, the chamber connection is one of those 4 core values that we provide. So I'm happy to make that introduction to your team, so you can get into Chuck's inbox and schedule. So thank you so much for your time, and thank you all for joining the call this afternoon.
Thank you.